Asia Society Hong Kong. I am Alice Mung, Executive Director of Asia Society Hong Kong, and I'm delighted that Professor Baron Peter Piot can be with us today. And Professor Piot is Director, Handa Professor of Global Health at London School of Hygiene and Tropical Medicine. And he is speaking to us this morning from London, where he is based. And so good morning, Professor Piot. And we are really—
Please call me Peter. Yes.
Peter? Okay, I will do that. We're really delighted because this program, Coronavirus Update, Hong Kong and Beyond, was designed to hear from the experts and also give our audience. We originally started off very much as a Hong Kong audience, but now has become a global audience to ask questions directly of the experts. And today we are really delighted to have one of the foremost expert discoverer of Ebola and also a lot of research in AIDS, extensive experience in public health, and we are eager to look to hear from Professor Peter. Peter, can you just give us a start, give us a summary? When we had the discussion about a week ago with the experts from Berkeley, as well as Professor Fukuda here at Hong Kong U, every week the situation changes, and it isn't just little changes, sometimes dramatic changes. And one of the major changes from just yesterday was the WHO declaring COVID-19 as an epidemic. And I know there are stuff also happening in London, in UK, where you're based. So can you just give us a quick summary of, COVID-19 right now as of today?
Yeah, thanks, Alice. And I just like to say that I'm a big fan of the Asia Society. I've visited you in Hong Kong, but also in other places in the world. So that's really pleasure to be here. Yeah, you're right. I mean, every day is different when it comes to COVID-19. Maybe first of all, declaring a pandemic, frankly, doesn't make much difference. We all knew it was a pandemic before WHO declared it a pandemic. And but I hope it will also, increase awareness that this is a really major global crisis that we're facing. Secondly, whereas initially this was considered a China problem, it's definitely no longer a China problem. Ironically now, many of the cases that are found in China are actually imported from other countries. And that shows that blaming one country doesn't, help and is unfair. But also that there's now kind of an equalization of risk. And for example, total travel bans and so on are no longer, make sense because the virus is everywhere. Also in Europe, since we're here in Europe, Italy shows how fast the situation can change. If we would have had this conversation 2 weeks ago, I may not have even mentioned Italy, or let's say certainly 3 weeks ago. And now it has the third largest number of cases in the world after China and Iran. And it's even on lockdown. Here in the UK, I think again, the virus is present here. It's no longer something that is imported, that comes from abroad. I think the government here is very active. We had yesterday the Chancellor of the ASHK announced the £12 billion special measures to deal with coronavirus, and we can come back to that. But also we are now discussing whether pure containment as the only strategy, whether that's really the only thing we should do. And today, COBRA, this is the National Security Crisis Committee chaired by the Prime Minister. They're meeting today, and it's anticipated that we will go to a containment plus, delay type of strategy.
So that will be discussed this later on today in London.
Yes, yeah.
And
still morning in London now, yeah.
So can you now also kind of talk a bit about social distancing? One of the things that I'm particularly interested in, because here in Hong Kong, when we started this program February 14, a very different world then. And social distancing is something in Hong Kong we've been practicing. I have to say, personally, social distancing sucks. No concerts, the museums have been closed. Only recently has the government offices reopened, and we're still not functioning, fully on 9 to 5 schedule. So, in terms of what you are seeing, what the other countries are doing, I know in the U.S. It's a big deal when they've postpone or cancel the St. Patrick's Day parade in New York. And also there's been talk, NBA games have been canceled. And it sounds like UK is going that route. So in terms of the success of social distancing, what grade would you give Hong Kong or Singapore, which is slightly, they're practicing it differently, but also what China has done? I guess social distancing works?
Yeah, I think that China has shown that it works. Certainly in Hubei province, when you see now the major decline, and as I said, more and more of the cases are no longer indigenous cases, but are imported cases. So there's a clear impact. The question is whether a complete lockdown, and for a long time in China, how feasible that is in other countries and in democracies, for example. I don't think that will be possible. Like in Italy has now, launched it, and Denmark. But social distancing is not just closing down events and schools and so on. Just maybe a little bit as a joke, but it is correct. There's already a lot of social distancing in normal times in Britain. People don't shake hands. It's not like Japan with greeting, but there is that may make it a bit easier than cultures where handshaking and hugging and so on is far more common. Another extreme example I would say is Brazil, where when you meet someone, even if you don't know them, they kind of already go over your whole body and so on. But besides that, I think there are gradients. For example, closing schools, there's controversy because we don't know what the role that children are playing in coronavirus transmission. It's very clear that was very important and is important for influenza control. But one thing that we are concerned about here, for example, is if we close down the schools, who's going to take care of the kids? It may be grandparents. And grandparents, by definition, are older, more vulnerable. And so maybe we make it worse. So we have to, the jury is still out. But I think here we're going to, in terms of social distancing, not a ban as in the US or in other countries. I think that, I don't expect that, but I think there will be particularly concentrating on two things. One is that more working from home and, avoiding major big events indoor particularly, but secondly, protecting the elderly and the most vulnerable, because that's also an issue, not only for the tragedy of a death in the family and the person, but also for the health services, because the National Health Service here already in normal times, just a seasonal flu, is at full capacity for its intensive care beds. And if we see an influx of lots of patients, as we're seeing in Italy, they can't cope with it. So that's delaying is really the way to go. But we should not give up containment. But once you have lots and lots of cases with lots and lots of contacts, there's simply no capacity to do all the contact tracing and all that.
Prior to this interview, I saw your interview with Talks at GS on February 21st. And in it, you mentioned, a possible relapse, for China, as people are going back to work, after the Chinese New Year holiday. And also, I just saw in SCMP, South China Morning Post, the Canton Fair, the Chinese government has decided that it was going to go ahead with it for mid-April to early May. So are you concerned that, China there is a possibility of slipping back to I know China has done a good job and so on and so forth, but are they, the Canton Fair opening and maybe the government is now relaxing some of these social distancing? Are you concerned about some of those efforts that maybe here in Asia we've been ahead of the curve, that some of the that we might be doing stuff, opening stuff too quickly, or do you think we're possibly on the right track?
Well, first of all, I think that the world should be grateful to China, for these draconian measures, which in a sense delayed the spread of of coronavirus throughout the world. Now, the question with these things is, how long is this sustainable? Because we're also a society where we need, the economy needs to go, we need education and so on. So it's going to be a trade-off. And so gradual reopening of manufacturing, of schools and so on is unavoidable. I mean, we can't continue to, to have everything closed and society come to a standstill until the last case of COVID-19, is either dead or, is cured or survives. And so that's a trade-off. And so, but I think it is going to be unavoidable that when there are, this reopening of factories or businesses, that there will be probably a second wave. But I'm quite optimistic, at least for China and for Hong Kong, Singapore, and particularly you and Singapore. You've done an exemplary, I think it's probably the best program in the world. That it will be not as dramatic as the first wave, because people are now, you adopt certain behaviors. There is social distancing. I'm sure there will be all kinds of measures, but we can't continue forever. And one thing that I advise to policymakers and so on is, so, okay, when you declare the social distancing or bans on this and that, what's the exit strategy? For how long? You have to think that one through, because it is also not only the uncertainty about the virus and about what it can do and so on, but also uncertainty of how long are these measures going to take, and that influences a lot, confidence of people, and even the stock market and so on. It's a duration that is a very important point.
I think you last September in an interview you did with Telegraph, you mentioned that, quote, "I didn't fully appreciate the social, behavioral, political, cultural contact that these epidemic thrives in." What do you think hinders our fight of the epidemic? How does the lack of trust kind of take place? It plays into the spreading of the virus. I think you mentioned in other interviews about the social media and fake news. And what can some of the solutions from scientists, politicians, and citizens here in Hong Kong? Last week we talked about as great have we've done here in terms of containing, but Hong Kong, as you know, we've suffered a lack of social cohesion these last couple of months. So how do you think, kind of the lessons from this, the importance of social cohesion, are the politicians aware of this, and are they playing into the fear in some cases?
Yeah, no, it's something indeed that I learned actually the hard way, but already many years ago when I first worked on Ebola. This was in 1976. I'm an old man. So, and that's when that was the first known Ebola outbreak. And and Ebola is not like COVID-19. It's actually not as transmissible. You need very close contact, no respiratory transmission. So anyway, however, what's key is trust. If people don't trust what comes out of the government or experts, and it won't work. And particularly in our times of social media, before all the information came, newspaper, radio, then TV, and that's it. Could be far more controlled sometimes. Although here in Britain we have a tabloid press, we should not underestimate what they can spread as fake news. But now in today's world, it's very difficult. And I've been wondering, indeed, in Hong Kong with what's been going on over the last year, how people, the public, would react in case of an epidemic. It's actually something. I was in Taiwan in December, and we were talking about that. And then I was in Hong Kong, and I said, if something happens here, an epidemic, we didn't know about COVID-19. But in the end, I think that it is working out quite well from a distance. But communication and openness and transparency. If people believe that the government or the authorities or public health also are covering up something or are not transparent in information, I think that could be counterproductive. And we've seen that already in the early days in Hubei, in Wuhan. Then you lose so much credit that your measures won't become effective. And it's very interesting to see that the World Health Organization, and also here in the UK, that we've set up a monitoring of all the news and the fake news about, for example, therapies or how to protect yourself, and that's circulating. Plus, also, what we're seeing here is very unfortunate: is racism and xenophobic attacks. Like here at the London School of Hygiene Tropical Medicine, today we have a whole session with colleagues who are of Chinese ethnic origin, including some from Hong Kong, and who told about their experience. Of course, that racism is always there, but now it's coming up. So we need to work on many fronts. And dealing with epidemics, I always say, it's not just a medical affair. Okay, that's in essence the easier part. I mean, you have to organize it, but it's communication, good coordination, and logistics, making sure all the things are there. So that's where we are.
Thank you. I think what you've touched upon is something that Asia Society here we will be exploring, is really this, the racism we're hearing about is almost global. I think there's been violence, and there's been, my worries is now it's the spread is now in the, both COVID-19 and also the xenophobic, the racism is also being spread in Chinatowns throughout the world, and it's really unfortunate. So there's a topic that I know Asia Society locally and globally will be talking about. And now with some of the questions that we've gotten from our audience, the social media audience, one of the questions that I wanted to pose to you is, what is your estimate of how much residual transmission there will be in major mainland Chinese cities when industrial production capacity fully resumes?
Well, let's look at the figures. Even in the worst affected province in China, in Hubei province, depending on what the actual figures will be, but between 0.01 and maybe 1% at the most of the population is being infected. So that's at the most 1 in 100. And officially it's much less, but I think many cases are still not detected or were asymptomatic. That means that probably that out of 9 out of 10 people, if not more, did not get infected, and in other words, are still susceptible and could become infected. So there is still a major threat, but again, you can't continue forever to stop social life. I mean, there won't be any food, we can't survive. So I don't think that means that everybody will become infected, but it means that when factories are reopened, schools, businesses, etc., events, that we need to continue to have the discipline of some kind of social distancing. But I think everybody is now much better prepared. Just as Hong Kong and Singapore, you benefited actually from the traumatic SARS experience.
Very much.
Unfortunately, you hadn't forgotten that, because often I always think, never miss a good crisis, in the sense that as long as we, learn from the crisis, then that's an opportunity, and that with the next crisis, we do a better job. And I think that's what's happening, and you benefit from that. And so in that sense, we can be more optimistic, but I don't think it's realistic to think that the virus will not rebound or that it will go away.
We have one question from the audience online. What is the situation like in the UK right now? And what are the concerns for the British most? I mean, this is really interesting in this post-Brexit UK. What is the situation there now?
Well, in the UK, we, as everywhere, we had initial cases imported from, came from China, from Singapore, and then mostly Italy has been the major source of infection. However, now they're spread in the community in the UK. It's still very limited as far as we know. Testing has only started to be widely available quite recently, but it's far more available than in the US, which is a big country. And the awareness is quite big. We are fortunate to have a system of chief scientist, chief medical officer, chief government scientist, and the policy is very, very informed by science and not necessarily totally by politics. That's the good news. I'm worried about coordination with the EU, because in Europe, frankly, there are no borders. I mean, even if Britain is an island, there's the Eurostar and some people come and go. So it's important there's close coordination. And Charles Michel, the president of the European Union, has had a special meetings with all the heads of state and heads of government. And now all the ministers of health have daily contact on this to harmonize the policies. Because people live in one country, work in the other country. I mean, like you have also, frankly. There's so much mobility, and the policies have been very different. For example, Italy, I mentioned it, was the first country very early on to ban all flights to China. Ironically, now it's the worst affected country. It didn't work. I mean, and because the reality also is, when you think of it, it's one case is enough. One person who, starts all this, and it may have started with one person, the whole epidemic, I think a lot about that. For example, I dealt a lot with HIV, which is also came out of the blue last century. And it may have started with one person, and in the meantime, 75 million people have become infected. It's mind-blowing what it can do. So I think in the coordination with the EU, I hope will continue despite Brexit, just as we need strong collaboration in terms of security in general, but also health security and a few other things, food security. And so I hope it won't be captured by the politics of Brexit on either side.
Can you, in light of what you just said about Italy, can you comment on what President Trump just declared today in terms of the 30-day travel ban from countries from Europe, except UK? And that I don't quite understand, but that was just declared this morning here, we heard. So do you think that's going to be effective? Because I know in the United States, I think the coast, there have been clusters of it. Is that a political maneuver, or is it a practical? I guess I'm trying to figure out, scientifically, does it make sense?
Well, we were all very surprised. I mean, I found out also when I woke up. And first of all, let's not forget there is transmission within the United States. Even if nobody is allowed to go in and out of the country, the virus is continuing to spread. And the US has only tested about 1,500 people, the whole country, until last week, which is far, far less than insufficient compared to any European country. And as I mentioned, take Italy. It banned all flights to China, and yet this was at the time when China was the source of infection. Thirdly, it's interesting that this ban applies to foreigners, but US citizens can come. It's not that US citizens have some natural immunity. against them. I'm married to an American, so I'm quite familiar with it. But so I think it's, I can't imagine that this will have any beneficiary impact on the spread of, COVID-19 in the US. So, yeah, and it doesn't make sense that it's only the countries of the Schengen agreement, so where you have a free circulation of people, and that includes also Switzerland and Norway, who are not members of the EU, but Ireland and UK, and I think Croatia and Bulgaria, I think, or Romania, they're not part of Schengen. So, yeah, it doesn't. I don't see the rationale, and I can't imagine that the scientific advisors, the heads of Center for Disease Control or the National Institute of Health, that they have advised the president to do that. But there are always surprises with President Trump, so we'll see. But from a scientific epidemiological perspective, it doesn't make sense. Frankly, as I mentioned, when all cases, or nearly all cases, were concentrated in one country, in one province, it did make absolute sense to have a travel ban and strong restrictions. But today, this kind of equalizing of risk. In other countries, Israel, it's also banning basically everybody. India suspended all electronic visas. My concern is now, if every country is going to do this, it will make the fight against coronavirus even more difficult, and the economic downturn will even be worse, without really contributing to bring this epidemic under control.
You mentioned, the testing, and Korea has really done a great job in terms of testing really quickly. And of course, the numbers spiked, but they seems to be, they are no longer a top 3. They're number 4 now in terms of the cases. So early detection really seems to be a key to containing this epidemic. Would you have any advice to hospital authorities or governments when implementing measures like infection control in hospitals and in that?
Yeah, early detection is really important. I mean, there's no coincidence that the title of my memoir about the, first Ebola outbreak and an AIDS is called "No Time to Lose," because when there's contagion, because this is about contagion, if you can intervene early on, you prevent not only the first generation of people got infected, but many, many generations and maybe even millions. Now, so I think that Korea is doing a great job. We need more tests, and at some point the tests become, pretty irrelevant. If there are hundreds of thousands of cases, you assume anybody who has a respiratory infection has it, and so on. But at the moment, we don't know enough, and we need to test also to find out the people who are asymptomatic carriers, because they could transmit the virus. And people want to know also. And for hospitals also, it's really important because they need to see who to admit and who to put in intensive care, who to isolate, and all that. So I would say, testing is one thing. And also the UK now has, relaxed recommendations for testing. So before, you needed not only to have the symptoms, but also have a history of travel to one of the affected countries. That history is no longer necessary, again, because there's transmission here. Now, but again, the experience from SARS is really important. Korea is not so much SARS, but MERS. They had quite a few deaths from another coronavirus infection coming from the Middle East. And, but there's very simple things that go back to the 19th century. Hand washing is so important, and people may not think about it because they say, oh, it's a respiratory transmission. But, we touch our eyes, our nose, and so on, and that's really key, but that's good for hospital hygiene in general. What is important, though, for any health system is that there are enough respirators, oxygen, that the healthcare workers themselves don't get infected. And let's not forget that they're often the front line, the first line, and many get infected. That's not only a drama, many have died already, or several, but that means also that there will be fewer healthcare workers to deal with a surge in patients. So I think that we're going to a situation where this will be a test, real test for, and a stress test for many health systems. And at the London School of Hygiene Tropical Medicine, one of our concerns are the poorest countries, low-income countries, some in Southeast Asia or in Africa with weak health systems. When COVID-19 is really, exploding there, that's going to be absolutely catastrophic.
Then last week we talked about this article that Bill Gates wrote for the New England Journal of Medicine about responding to COVID-19. And his concern was the low and middle income countries.
Yes.
And you have work in these areas with Ebola and all that. Are you concerned that not enough resources or is committed to this right now? I think it seems to me this particular virus really hits this part of the world. China, whether it's developed or developing, but China cope with it. And then certain countries have coped with it in different degrees. But do you think the next, is it going to hit the LMICs? And are you concerned, being more familiar with the public health service of these countries, how are they going to deal with it? I know there's been money that the Gates Foundation have made a donation of 100 million initially. So how do you think, that the LMICs, are you concerned?
Yeah, very concerned. And as I mentioned, for our school here at the London School of Hygiene, that's a priority. We provide support to other countries, also in Asia, but Africa is actually our priority now also because half of our staff are based there. So we have good relations. And there's the issue that there are over 1 million Chinese living now in Africa. So there's a lot of connection, and there are 5 daily flights from Addis Ababa, the capital of Ethiopia, to a city in China, and that has continued. So there are lots of Africans going to China for business, for study. So there is that connection, even if now maybe China is less of a concern in terms of a source of infection. But the first cases have been reported, and we are in a situation where they're very poor and, literally poor, but also insufficient health services like hospitals, intensive care units. So that means that once the virus is there and people are infected, that mortality is probably going to be much higher, because mortality depends, of course, in whether you have underlying conditions and so on. And sometimes it's the weakest of us who will die, of course, but also the number of respirators, the intensive care that you can provide so that people get over this critical period of total respiratory distress and so on. And then also the public health systems of laboratory infrastructure, contact tracer is very weak. However, the good news is that particularly since the West Africa Ebola outbreak in 2014, which killed 11,000 people in 3 countries, that has been a wake-up call. And several countries have really, created the Centers for Disease Control, like Nigeria is a really good one. Very important also, there's now an Africa Centers for Disease Control under the aegis of the African Union. So it's not there yet, it's not perfect, but we're in better shape than 5 years ago. But here, my major concern is the impact on health services that are really very underfunded. So the lesson is that we must invest in these systems in between epidemics. We behave in the world a bit like we would have a fire brigade that's only set up when the house is on fire, and when it's over, we just send everybody home. No, we need that fire brigade all the time, and we all hope it will never have a job to do.
Good point. One of the questions I want to kind of ask you about right now is really about what are some of the tools at our disposal to fight against the COVID-19. I know there's talk of vaccine, it's still going to be probably a year or so away. Do you think there is sufficient investment that is being made right now in prevention and for future epidemics?
Yeah, first of all, the tools we have today are very, very limited. I mean, they're not different from the Middle Ages, frankly. I mean, it's isolation, contact tracing, and then isolating the contacts, public education about hand washing, again, not very sophisticated technology, and then providing care for those who are, critically ill. But that's in contrast to influenza, the flu, because the influenza still killed more people per year than COVID-19. But there, the big difference is we have a vaccine, even if people don't always take it. But we have a vaccine, we can do it. In the case of COVID-19, I'm quite optimistic that very soon we'll have effective therapies. There are lots of clinical trials going on with existing antivirals that can be used to treat, for example, HIV infection or Ebola, and they can be what we call repurposed. So they're being tested now in trials, particularly in China, but now also increasing in other countries. And that, frankly, we should know. What we know? And I think in April already, we should have an idea of what works and not, and then make sure it's available. Vaccine development, very important, but we have to be realistic. The good news is lots of investments. The Coalition for Epidemic Preparedness Innovation, CEPI, and I'm a founding board member of it, has issued 8 contracts to companies and universities to develop this vaccine. So, it's going to take, as you said, a year, maybe 18 months before a vaccine is really available for people, because it has to be tested. One, we don't even know for sure that a vaccine is possible. That's why you need to do all the research. Let's not forget that for HIV infection, we've been working on a vaccine for 35 years. I mean, the world community, and we still don't have one. So it's not always certain that it is possible. So we need to do the test. We need to make sure that the vaccine is not only effective, but also that it's absolutely safe. And that takes a long time. It has to be tested. There are no shortcuts you can take. So I think for all practical purposes, for the current wave of this epidemic, a vaccine is not going to be available. However, it's highly likely that this virus will be with us and will circulate in the world, forever maybe, and that we would have a vaccine for the next, the next flu season. That is what the hope is there. So, but there's good investment in it, but it's extraordinarily expensive. Developing a vaccine costs about $500 to $1 billion for one vaccine. And then you have to think also about manufacturing. We need like 1 billion or more of vaccine doses. That's not something you can make overnight. You even have to construct special factories. You have to be commissioned. There's no contamination. It's safe and all that. So there have been statements in the media by some scientists, though, we'll have a vaccine in a few months. I'm very sorry to say that's not going to happen.
We have a question from the social media audience. The question says, is COVID-19 the disease X, the unknown pathogen that the WHO has been flagged as a priority? Is this disease X?
Yeah, yes and no. I mean, it is disease X in the sense that that was made for, or the term was created for a new virus, and particularly a virus that is respiratory transmitted. That's X. But we've had new viruses emerging, and you just see in my short life, from Ebola I was involved with, there was HIV, we had SARS, we had MERS, and we had a few others. So it will always happen. And the worst case disease X or virus X would be transmissibility, as the SARS-CoV as it's called, the virus that causes COVID-19, this coronavirus, but with a mortality then like of SARS. Or worst would be, a nightmare would be an Ebola that is transmitted, respiratory transmitted. So that's, so it can always get worse. But I think we are, this is not a drill, this is the real thing. And particularly not only the uncertainty, but the potential for millions and millions of people to become infected. And even with a fairly low death rate, it's still going to kill tens of thousands of people. But again, we've been there before because we have influenza, flus, that influenza viruses that change and that can also cause major epidemics. Like in 2009, we have the swine flu, H1N1, which killed about 300,000 people in the world. But interestingly, that was not such hot news as it is now, with COVID-19.
One of the questions that I have is, you were the founding executive director of the UN AIDS and Undersecretary General of the United Nations, I guess, 95 to 2008. How far do you think we've come in terms of international collaborations in combating epidemics such as HIV and things like this? Can we do more in terms of further strengthening our response during this time of crisis?
Yeah, I think HIV is a good illustration how something that started with the first reports about, didn't even have the name AIDS yet, was from California. I think it was 7 or 9 gay men with a mysterious pneumonia also started, but of a different kind. And then cumulatively, 75 million people have become infected. Who would have thought that that would be possible? It just illustrates how things can evolve. Yeah, I think we've made good progress in terms of international collaboration. When I compare the response to COVID-19 and SARS, it was much faster, more transparent. The virus was isolated in early January, and already on the 9th of January, the sequence of the virus was shared with other scientists. They immediately started working, diagnostic tests, etc. So that sense, the world is a bit of a paradox. On the one hand, we've got populist movements and nationalistic type of reflexes with, and some of the travel bans are based on that. And on the other hand, there's really good international collaboration. However, where we have not done enough, I would say, is invest in preparedness. My point that I made earlier, let's make sure that after each crisis that we're better prepared and we do a better job. I think the worst is not to have a crisis. Nobody planned for this, and you can't prevent these outbreaks from happening. But let's make sure that we are better, prepared, and we learn the lessons. And sometimes I feel that when something is no longer headline news, there are so many other priorities in life and for a government that we neglect this preparedness. And that's, I hope what will come out, and that we need a bit more, investment, particularly in the countries that are, poor, less well organized for, historic reasons. They need support and build up their systems. And that's what we call, then global health security.
In your book, AIDS Between Science and Politics, you mentioned that quote, science does little good when it operates independently of politics and economics, and politics is worthless if it rejects scientific evidence and respect for human rights. How do you think in this situation scientists should interact with politicians? And because I think you mentioned the AIDS is such an interesting topic as well in terms of the political backdrop that it brought, especially in the United States, as I remember with the Reagan administration. In times like this, I really respect, I've always respected scientists, I think a man of learning, but in times like this, we especially appreciate it because you see them on front line battling, the virus itself, but sometimes also battling for what is truth. So how do you think scientists, right now in this situation, how can scientists and politicians work together?
Yeah, I'm impressed you read all my books, and but I learned this the hard way again. I mean, I came into the AIDS response from an academic background, scientific background, and as a clinician, seeing patients. And I thought, okay, if we have the facts, things will be organized. But then we were confronted with a lot of stigma, denial in many, many countries. And so I said, okay, we can have the best discoveries and the best knowledge, but if either society rejects it, we talked about that before, or if there's no political leadership, it's not going to happen. There won't be budgets and so on. And on the other hand, on the other extreme is that I was confronted with the situation in South Africa, where then President Mbeki, denied that HIV existed or that AIDS was caused by it, and that delayed enormously the response. So I think it's really important that we scientists, we communicate, we get out of our ivory tower, and we inform. We're not in charge. I mean, that's the job of politicians. I must say that the UK has a really great system of chief scientists, chief scientific advisors in each department, plus the government chief scientist. We have a chief medical officer. And I must say the policies here are very, very well informed by scientific evidence. And we also, like here at our school, we have media training. I really encourage our scientists to learn how to communicate without using acronyms that nobody understands and hermetic language. That's a bit of our problem. And so I'm really very, very committed to this kind of coalition, if you want. This is the kind of things where we need everybody. We need politicians and political leaders, absolutely. We need the scientists. We need the communicators. And and I said always that journalists can save more lives than scientists sometimes, as long as the reporting is accurate. And also in today's world, and it's the people, of course, and the social media. You can't control all that, but I think scientists still have high credibility in many societies. As long as we're not going to be like self-serving, make a statement and say, "Come on, give me the money to pursue my hobby," and because that also happens.
No, I think the reason I asked this question, I think during this time of social distancing, a lot of us has been watching Netflix, and the one particular show that one of my colleagues recommended, and that I had a chance to watch it during this time, because there is nothing we can do. There is no museums, no concerts, so on. Has been the film, I think a documentary series, Chernobyl, and it's really the struggle between the scientists and the political party and what is truth. So in terms of the storytelling, I think the role of scientists, is really important. I think, their research and so on. So I that's another reason I've been so curious, very interested in the views from your perspective. But one of the questions that we also have now in the audience is about, it's asking about, is there a meeting, and you mentioned some of the health experts in UK, is there any meetings of the health experts in the UK, and what are some of the discussions surrounding that you guys are all discussing on COVID-19 or other epidemic that you are concerned about?
Yeah, first of all, I think that one of the jobs of a scientist is to speak truth to power. And but that's not always welcome, and we've seen that, in China, for example, and in the history of AIDS, and it's there is an inherent tension, because often we come with very unpleasant news, But here in the UK, yes, there are several advisory groups of scientists to the government. For example, here at our school, we have very strong mathematical modeling groups. We have about 25 mathematical modelers full-time working on on COVID-19. And frankly, I don't have even the time to watch anything. We're non-stop working, and so what are they doing? They're trying to figure out what's the trajectory, how long is this going to last, what's the peak, what are the needs in terms of beds in intensive care units, who does airport screening and fever, does it work? And we know, for example, that 1/3 of people don't have fever, so you'll miss them by that, but it doesn't mean you shouldn't do it, but I mean, we have to be realistic. Closing schools, social distancing, what does it mean? So that kind of discussions are there. A lot are, virtual over Zoom and so on. We have done groups dealing with therapeutics, vaccine group. Here at our school, we have a weekly meeting of a COVID-19 task force where we exchange information and also with colleagues from all over the world. And so, fortunately, we have all this video technology that we can have, just as we do now. Even in 2003 with the SARS, this was not very well developed. We didn't have Zoom and FaceTime, and so it was kind of a bit of magic that you could see someone you talk to, and not to mention even the time of the Spanish flu. So now this communication is much more developed, and that's good. So we can also working from home, but there is really great collaboration at this stage between and among scientists. There's a bit of competition also, but I think that's healthy. There's no problem, and across borders, I would say, we have, for example, we have regular contact with Hong Kong. By the way, Hong Kong University was founded by the same person as the London School of Hygiene and Tropical Medicine, Sir Patrick Manson, but before us. So that's why we consider HKU as our big sister. And there's a big Manson building, and he started the what was called Hong Kong Medical College for the Chinese, and then a few years later he founded our school. So we have lots of interactions, and you have some of the best scientists in this field, and maybe people in Hong Kong don't always appreciate that, but I can tell it as an outsider that that's the case.
Well, thank you for that, because that was one of the reasons we started this webcast, because we know here in Hong Kong what happened 17 years ago with SARS, and also even before that, 1916, when Pasteur was here. So Hong Kong, when it comes to infectious diseases, has a history of being there. In fact, we have most people do not know, we have this really little medical science museum near Hong Kong U that really chronicles some of the history of these early infectious diseases that Hong Kong has played a role. And that was another reason that we felt it was very important for Asia Society Hong Kong to take the lead. And we've been so gratifying that we've been able to talk to scientists like yourself and really scientists from all over to really ask the question directly of you, so that, and you're right, the technology has enabled us to do this, and we've been able to put together a program like this fairly quickly. And last week we did it in 3 time zones, and this time you're in London, and it's really, we're very delighted, and we really want to thank you for taking part and helping us with this discussion. But before I let you go, we do have one final question from this part of the world. And I don't know if you are, well, 2 questions and travel related. What will be the trigger for the general public to be able to resume traveling again? How should we protect ourselves when we travel on planes?
Starting with the last part, that's a bit more, but it's probably safer to travel in a plane than take the tube, the underground here in London. And the reason is that the air in planes is recirculated through so-called HEPA filters, and they filter out certainly bacteria, depends on the type of filter. So that is something that, it's not absolute, and you can still become infected, particularly for, your neighbor and so on. But I think that the risk assessment is such that personally I will continue to travel. However, the question is a very, very relevant one for many respects, and that is, when can we resume? And frankly, it's going to be a trade-off again, and also between which countries. But it seems that at the moment, the mood is for more travel restriction, more travel ban. And I assume that once the number of cases is below a certain level, that we can start again. But here, I really think it's not going to be, how to say, pure science. This will be a combination of a bit of science, a bit of politics, and a bit of gut feeling. And that's the reality. I think we shouldn't make it more rational than it is.
I guess the last question would be really here in this part of the world, and we have colleagues in Japan, and people have been worried about, maybe the Olympics. And but part of the question has been about the heat. Will when it gets warmer, is the virus going to go away? And I've read things of both pluses and minuses. So in your expert opinion, I mean, what do you think will happen in July and August, and will it impact the Olympics in Tokyo?
Well, first of all, we really don't know whether this is going to be seasonal, and when temperature is going up, there will be no transmission. I doubt it, because let's take Singapore. They're doing a great job, but they have also transmission there, and on the average, it's like it's about 30 degrees every day, throughout the year. So I wouldn't count on it, but who knows? It could be decreasing. As for the Olympics, this is a mega decision that's going to be very, very difficult. And let's hope that by July, with all the measures in place, it should be, we should be really over, not only over the peak, but probably very low levels of transmission. But nothing is sure. And it could be, what are we going to do if this virus is going to continue to circulate for years before we have a vaccine? Are we going to stop any sports activities? And so Brazil faced a similar problem when 4 years ago, when there was the Zika epidemic, and which was particularly concerned for pregnant women, because if you're pregnant and you're infected, then you can have a child with major neurological deformations, including like a small head and so on. And there the advice was, okay, they went ahead, there were no major problems, but pregnant women were advised to stay away. In this case, it's not so it's not so specific in terms of groups. So, but we could imagine that you have Olympics, but where, for example, in the stadium, there's a seat in between every person. There may be ways of managing it, but I'm not involved in these discussions. But what we're doing also more and more is that instead of canceling events, we make them virtual, and you can live stream, you can follow a concert at home. I know it's not the same thing, but that's the way to do it. And so, for example, I mentioned we have an event about racism and the discrimination against ethnic communities in China, Chinese, here at our school. Well, we decided it's so important. People need to know. We want to raise our voice, and what we're doing, a lot of this will be followed by people all over the city, maybe outside, and in the auditorium we have space in between people who sit there. So it's about minimizing the risk, but we cannot completely cancel the risk. Otherwise, we shouldn't even live. I mean, we shouldn't also take a plane or whatever across the street. So as a society, this is also the time to think through what's the kind of risk that is acceptable and how to manage that. That's more of a philosophical consideration to end this conversation.
But thank you. That is such a great way to end on, because for an organization here, we were traditionally doing our program live with people to people, and not having to do that for the last 2 months. We have not stopped impacting. In fact, I think the initial number for a program like this was 1,000 to 2,000 people viewing. And traditionally, when we've had a successful program, we can only hit about 300 people. So we're really delighted and very grateful to Professor Piot for taking part in this episode. And then stay tuned. Next week, episode 6, we will have Dr. Wilson Lam, a doctor here in Hong Kong at a Gleneagle Hospital, who is dealing with infectious diseases. So we're really delighted. And then episode 7, Professor Mark Lipsitch from Harvard, T.H. Chan School of Public Health, will be with us on March 26th. So we're delighted that the technology has been able to allow us to bring a program like this. And again, my deepest gratitude to the professor, and I look forward to welcoming here. I think you're right. I think there is still nothing like a face-to-face program, and we will, anytime you're here in Hong Kong, we look forward to welcome you to speak for us. So thank you for joining us. Good evening.
Thank you, Alice. Real pleasure, and I'll be back at the Asian Society.
Thank you. We look forward to welcoming you then. Good night. Thank you, and look forward to for all of you to join us next week for our episode 6. Good night.